Okay.
What's going on, everybody? Welcome back to another edition of Vulnerable Moments, the podcast. I'm your host, Joe Bonjay Palmer. As always, we have special guests sharing the most transparent and vulnerable moments. We are live at the Evece Mental Health 5K. I ran into Dr. Michelle Cooke today. She's going to tell you all about how trauma affects our own medical, right?
Absolutely.
Trauma
Yeah.
affects us physically, mentally, and emotionally, and how you as a doctor can help us individuals overcome that.
Absolutely. Absolutely. Thank you for having and talking about this vulnerable moment.
Absolutely.
I think vulnerability is so important when it comes to medicine.
Yeah.
And I love that you asked about how does trauma impact our health, because I practice from what I call a lifestyle medicine perspective, which
Okay.
means that our behaviors really impact our health outcomes. A lot of what I see is related to lifestyle, right? And a lot of that starts with our mental. So let's say in our community, so I really focus on treating Black women. I care about Black people. Black women is my focus, but I say I take care of Black women, the people that they love, and those who love us. So everybody's welcome, but we really specialize in Black women's healthcare. What is the number one thing I see with Black women? Stress-related conditions. They're stressed out all the time, so they're emotionally eating and they're gaining weight. They're stressed out, so their blood pressure's high. They're stressed out, so they're not sleeping. Now their cortisol levels are higher. Now we're looking at high blood sugars and diabetes. And so I think a lot of doctors, you come and they do the blood test panel, they check your blood pressure, they say, oh my gosh, your pressure's high, your sugar's high, let's do this pill, let's do that pill. But no one ever stopped and say, what happened last night? What's going on? Like, where is this coming from, right? So I feel like so many of my patients are missing that mental health access and that understanding of how much what they're going through mentally is affecting them physically.
You pretty much treat mind, body, spirit.
Mind, body, spirit. And you talk about vulnerable moments. I wanted to share part of my journey.
Okay.
I think when people say that, they look at doctors, they think we're the cream of the crop. You've hit, this field of medicine. And MD used to be a golden ticket at one point in time, and it is not that way anymore. And about 2 years ago, I was really struggling with burnout in my practice. I tell patients I love what I do, but I hated the way I was doing it. I was seeing way too many patients, not enough time with them, not enough time to really get into the deep parts of what's affecting them.
Okay.
So you go in to see a patient, and I've had patients tell me, Dr. Cooke, I thought about killing myself last night. But when you're on that corporate wheel, you've got 15 minutes to see them. So how do you turn your back on a suicidal patient, right? And that person's traumatized, but having to say, oh my gosh, I only got 10 minutes with you. I know you want to kill yourself. Here's the suicide hotline. Let me run out the door. That's trauma for a doctor too. And when we're doing that over and over and over again, it's a quick, wet route to burnout. So I struggle because I never thought I was suicidal, but there were many times I thought, I see why people want to check out. Like, I can see why. Like, I empathize. Exactly. I empathize more than I ever thought I would. It's like, I don't want to leave. I've got my husband, I got my son, but I get it. Like, it feels like you're trapped, and I feel like there's no way out. And then something started to happen. More trauma came that ended up being a light, where the health system I work for actually shut down major hospitals here in the Atlanta area, and my clinic was threatened to shut down too. So I was terminated from my position because I didn't think I was going to stay open. And terrifying. I have this salary, I have this job that I'm used to. I hated it, but I was used to it. But it pushed me to do something new. And that's how I started my practice, Soul Direct Primary Care. And it finally allowed me the permission, or I had to give myself permission, right? We have to give ourselves permission to follow my dreams. And that's how we started the practice of taking care of Black women, of being unapologetic of who we serve, and setting up the life that's going to help me live healthier. Along that journey, I shed 50 pounds because that stress was finally gone. I could focus on my health. I love that we're at a 5K today. I started running 5Ks. I ran the Peachtree Road Race. I also started my yoga journey, which is huge for mind-body medicine. So every day I start with that yoga and meditation, getting my mind right, and that's how I have a better day. So a lot of trauma along my journey, which I think has helped me empathize more with my patients and talk about, before we start this blood pressure pill, have you tried some deep breathing? Let's do a yoga class together. Let's introduce some of those other things that may help with your mental health.
So I've had high blood pressure for the first time in my life. It was stress induced from the last job I was working. And I went to the dentist. They took my blood pressure. It's like 160.
Woo!
Never a day in my life have I ever suffered from high blood. It runs in my family, of course. Or I don't even say it runs in my family. It's just something that my family has taken on. More so, because you can, of course, get rid of high blood pressure through meditative practices, diet, of course, healthy eating and everything like that. So when it comes to stress-induced jobs and stuff like that, like what do you say, of course, specifically to Black women?
Oh my gosh!
Looking to climb the corporate ladder, who are taking care of families, friends, and everything like that. Like, what do you typically say to your Black women that you work with who are facing like high blood pressure, diabetes, stress eating,
Right.
emotional eating, stuff like that. Like,
Right.
say, like to them and their traumatic experience that they're facing.
Absolutely. So I think the first thing I say is set your priorities.
Okay.
Set your priorities and really be, in some ways, a little bit selfish about those priorities. So, for instance, my priority is my health and my family. Like those come before anything else. When you're in a physician space, there's all this pressure of, do you want to be published or do you want to, have all these accolades? So sometimes you're chasing things that really aren't in line with what your true priority was, and what was suffering my health and my family. I was gaining all this weight. I couldn't make it to my son's school appointments. I couldn't see some of his recitals. So I wasn't putting my priorities first. What did that mean for me? I walked away from a huge salary. Terrifying, right? To be able to start my practice, to think, am I taking a step back? All this hard work I put in?
Yeah.
But I've never been happier, and my family has never been more solid than it is right now. And so with that, I know that those financial blessings are coming because finally I'm in an alignment. So I have some women that are not in a position to just walk away, right? Like maybe they have support, maybe they don't. Maybe you do have to keep that corporate job, right? But what is your priority, right? So I'm not saying you got to silent quit, but maybe it's like when that job's asking you to do X, Y, and Z, really ask, is this required of me? What is the minimum I can do to make sure that I can take care of myself? Maybe they want you to take a weekend assignment, but weekends is when you do your self-care, and that's when you do your exercise and your 5Ks. You don't take that. So be very clear about your priorities. And if what they're asking you does not fall on your priorities, you have to have the bravery to say no. You have to have the bravery to say no.
So how do you implement the word no to your patients? Because that's a hard thing when you're in a job where you feel as if, because I've been in this space where you don't have a voice.
Yep.
You feel as if, if you quit, that's the end of your livelihood. And today's job market is already stressful as well when trying to find a job. What do you say to your patients when they are in positions like that where they say, I can't say no, I don't know how to say no? And but you as a practitioner are seeing their charts and you say, well, if you don't say no, this is what's going to happen.
Right. And unfortunately, I have times where I feel like patients can't say no, and then life says no for them. So I have about 2 people out right now on mental health leaves, so it's like, I can't say no, I got to work. I had one patient, she was working all night long to get like lesson plans done and do all these things for that her job was requiring from her. And she finally hit a wall and burned out. It's like, I'm not sure if I want to be here anymore. And so we had to take her on leave because she was not okay. So not saying no can get you in a lot more trouble, than trying to push through it. That just doesn't always work.
Yeah.
So again, get your priorities in line and see what can I take off the table. Because sometimes in this effort to climb the corporate ladder and the effort to do more, like you're putting more and more yourself out there and people are taking. But when those companies have to go through layoffs, they don't care about us. They don't care. So you have to really be careful with how you're negotiating time when you get into those positions. We always have a choice. We may be afraid of what's on that other side, less salary, less this, less that. But if you're feeling better and you're finally moving in alignment, you are going to have your blessings come.
So my next question is, what if you have a patient comes to you, you see all the signs of like, a traumatic experience that they're going through.
Yeah.
They either don't see it or don't want to, or they see it and don't want to like actually tell you.
Right.
How do you speak to that when it comes to a patient comes in, black woman, black male,
yeah,
be, and they're saying, oh no, I'm fine, but the chart is saying different.
Absolutely. Perfect question. So I think the first thing, an important thing about the primary care, because a lot of us don't have a good primary care experience. It's been very hard to get. You need a long-term relationship with your doctor. Not everything is going to happen in one visit.
Right.
So think about how long it takes us to come to realizations or to come to epiphanies. And so I think the biggest thing is to introduce the idea and always be there for that patient. Because the first time they're going to be in total denial. And we have to recognize that denial saves us sometimes, like sometimes we suppress things because dealing with it in the moment is way too hard. So there's a role for denial, and to ask somebody to unpack that denial is asking them a lot. So if they come in and it's like, ooh, like we really haven't dealt with the fact that you are still holding on to this or angry about this, or you seriously suffered some trauma here, we have to unpack that. No one wants to open that suitcase. That hurts.
Yeah, for sure.
That hurts. But at least we've talked about it. We put it on the table. So when they walk away, they're like, Dr. Cooke is really worried about this. Maybe I have to think about it. And then they come back to see me next time. They're like, Dr. Cooke, remember how last time you asked me about this? Well, I might be ready to talk about it now. So being there, making sure you're a safe space to come back to will open that conversation. But no, it does not happen. Rarely happens on the first visit.
So now you're speaking on safe space, which is a great segue to my next question, which is, Black women specifically don't feel safe with their doctors, primarily around pregnancy.
Ooh.
We've seen so many deaths around pregnancy
Yeah.
where the husband or the significant other, whoever it may be, they have to choose between their child or their spouse.
Oh my God.
And we look at data, we look at statistics and everything like that, and we see how things could have been avoided.
Yeah.
You as a primary care physician,
Yeah.
I know you're an OB, but if you can speak to like how do Black women advocate for themselves on the do you call
Yeah.
it table or on
Yeah.
the bed or anything?
Huge question, and I wish we had a great solution right now. And I'll just be honest, we don't. So my background is family medicine. So I'm a primary care doctor, but I say that because family medicine doctors train in obstetric training. So I've delivered over 100 babies in my career. I actually did prenatal care up until about the pandemic time. So I would take care of women and I wouldn't deliver them, but I would do their prenatal care. Then they'd go to the hospital and get delivered by the doctor in the hospital. So I'm very intimately connected with pregnancy care. I'm devastated with where it is right now. And I'm at a point where when my friends tell me they're pregnant, before I can get excited, I kind of get scared, because I'm like, oh gosh, when is that preeclampsia coming? When is like most of my friends that get pregnant have a horror story. It's rare that it goes smoothly. So we are in a bad space. The statistic is showing that when we have a bad outcome, so maternal mortality or preeclampsia, that 90% is preventable. So we're just 90%. So we're just not serving women appropriately. Like we know how to prevent this and we're not doing it. And so a couple of tips I would give. Number one, we know that the best care comes from culturally concordant care, meaning get a doctor that looks like you.
Sure.
There's a crazy study, and I wish I could remember who did it, that showed that Black newborns, babies, have better outcomes when they're cared for by Black doctors. These are babies. Like they're not coming in with baggage. They're not coming in. They're babies, but there's something about the way that we look at ourselves and we see the humanity, we take better care. So if you're able to get access to a Black doctor, and no, not everybody is, but if you are able to, that should be the priority. So the minute you get pregnant, I'm looking for a Black OB. Second thing is, my practice is a membership-based practice, which means that patients pay a monthly membership fee to join. It's different.
Yeah.
And the reason I did that is because the insurance space does not always protect us, right? Insurance has to make rules for everybody, and those rules don't always fit for Black women. So a lot of times you're narrowed into these spaces where you can't really serve somebody because they're like, insurance is paying for it, so here's what we're limited in doing. I had to walk away from that because I was forced to make too many decisions based on insurance and not what my patient needed.
Okay.
So we have to think about paying for our care differently.
For sure.
That's a hard pill to swallow when we're already budgeting here and there.
Yeah.
But I'm not going to knock my ladies, but we get our hair did, we get our nails done. Like there's certain things we're willing to invest in, and we have to start changing our thinking about how we invest in our health care. So looking at practices like mine where it's like, okay, I'm not even using my insurance because they haven't taken care of me. They deny my mammograms, they deny my MRI, they deny, but my doctor's going to fight for me. And that's exactly what I do for my patients.
Under your subscription-based model, they're able to get the mammograms and all the stuff the insurance may decline. How does that work out?
Right. So for my services, they pay the monthly membership fee.
Okay.
So when they go external, so I don't do mammograms at my office, but if they go, I can send an order, and if they want to use their insurance for a mammogram, they can do that. But I also have connections with a lot of cash-based facilities. So for instance, I had a patient that needed an MRI. Insurance denied it. We got her an MRI cash-based price for $400. Now, for comparison, let me finish. For comparison, I had another patient who needed an MRI, used her insurance, and had to pay over $1,000 to get that study done. Right, after the insurance. Yeah. So what we're learning is that insurance more lately has become much more of a scam than anything. So when you pull out their insurance card, you're actually telling them, I want to pay more for this service. Mm-hmm. So when we pay cash, we can actually get a lot more done. So when my patients come and they don't have insurance, I'm almost happy because I'm like, oh, I don't have to worry about this beast that's going to tell me what I can't do. So think about using cash as your dollar, as your power.
For sure. So because you see a lot of people like leaving the country to get these services.
Exactly.
Because it's a lot cheaper. I think in Turkey you can get a whole done pretty much body and and it's like $800.
And we have many of those options right here in the States, but we're just so stuck on the insurance model that we're not exploring that enough.
So speak to the cash-based model here in the States. So people who are watching or listening, they know exactly, okay, cool, I don't have to buy a $1,000 ticket to go to Turkey, which would be nice,
Right, if you want to, right? Yeah.
If you can't afford to leave the States and, get to a Turkey or get to a Mexico and get these services, talk to one specifically here in Atlanta.
Yep.
What you know, and then maybe other places. Like, how does that work out?
Absolutely. The first tip I would give is if you're looking for a service, ask for the cash-based price first.
Okay.
Don't even tell them you have insurance. Ask them what the cash-based price is first. And the reason I say that is because sometimes once they know you have insurance, they can't even talk to you about what the cash-based prices are. So you're not even going to know. Right. They have to say, okay, so if you want to use your insurance, now we have to follow their rules, and they're going to go down this pathway that just doesn't make any sense. And it's very convoluted, and often a lot more expensive. So very first thing you should ask them is say, I'm not using my insurance, or I don't want to use insurance. What is your cash-based price? And get that number first.
Got it.
And then if you like that number, go with that. If not, you can say, well, if I did use insurance, what would it be? So now you can do a true comparison. But if you lead by saying, I got my insurance card, they're going to give you whatever's on that contract, and you're not even going to know. Now you can't even get access to the cash-based prices. So I would start by asking your cash-based price first.
So at first, in advocating for yourself, is asking questions.
Right.
Okay.
Asking questions, and ask them not like to run it without your insurance and just see what it's going to be. Because more often than not, you're going to pay more when you bring your insurance card out. It sounds crazy.
I mean, it's just like the dentist in a sense. You go to the dentist and it costs you an arm and a leg. I'm like, what's the point of me having this insurance and I'm paying for it every month? Where I'm paying more out of pocket. You know, I've been looking at going to dental schools to get my dental work done.
Yeah.
Going to local practices.
Yeah.
We say, hey, we offer XYZ for X price. You know, we can do payment plan, we can do XYZ. So I'm like, I'm looking at more of a cash-based model now because it just makes more sense.
Right. And you have to think about the model, right? The more people between you and your doctor, the more you're going to pay. So insurance is a middleman. They're the broker. And so they got to get broke off. So if you're paying this money, they're going to be taking their cut before it gets to your doctor. So when people, get frustrated and they say, Dr. Cooke, I really want to go to you, but you don't take insurance. It's like, there's a reason why, because you're actually paying your broker a lot more than you're paying me. And I'm the one taking care of you.
So how do you explain to a new consumer of yours who says, my insurance costs me $50 to $100 a month versus your cash-based model, maybe XYZ, whatever it may be. How do you make it make sense to the average Joe?
So I would say let's work backwards a little bit, because I think insurance has gotten to a place where it's out of control and it's not serving people anymore. What we really need is catastrophic insurance care. And then we need to pay for health care separately. So I tell people I think we should go to a model that looks more like car insurance. It's reasonably priced. Something bad happens, you call your car insurance. So if you crash your car, you're going to call car insurance. But you're not going to call your car insurance if you need new brakes. You're not going to call them if you need gas. You're not going to call. So all those primary care things you handle separately. You find a good price. If you want to go to the highest mechanic out there and pay the premium prices because they have a great lobby, you can do that. If you want to go to Meineke and get the discount, you can do that. But you use your dollar the way you want to use it, and then you only use your insurance when you absolutely need to. The way we do insurance in this country is it's not insurance anymore. It's prepaid health care. It's this weird package. The fact that it's supposed to cover everything means it's no longer insurance. Insurance should protect from the catastrophic. So we really need to get to a place where insurance is affordable only for catastrophic care, and for the basic things, your primary care, getting your MRIs, you find a cheap price and you just get it done that way. So if you get a direct primary care membership, which is my model of care, concierge is a similar model of care, you pay for that membership. There are things you can pair with it. I recommend having something catastrophic, which right now is mostly insurance, but there are these things out there called health shares you may have heard of. So there's a couple companies. Can I share names? Okay. So I'm glad I'm introducing this. The big companies, hopefully it's okay to share their names. There's one called Zion, Zion. There's another one called Sedera, Sedara. They are technically not insurance. They are, it's a pool. So they gather people, they create a risk pool like insurance does.
Like that.
Exactly. You pay into it.
Yeah.
And let's say you have a health expense that exceeds $5,000. That's when you call your Zion, your health share, your Sedera, and say, hey, I got hospitalized. And what they do is they call the hospital, negotiate on your behalf. Get that rate way down, you pay your deductible, and they take care of the rest. So it really is a catastrophic form of insurance.
So is that something that your practice accepts? So if someone says,
so we don't so we recommend you pair it with our practice, right? Okay. So almost like car insurance, right? Your car insurance you only use when something really bad happens, but you buy that separately from where you get your brakes done. And like they're different from each other. Gotcha. So I'm like your brake guy. Like you get your tune up with me, and then if you need insurance, you have a whole separate plan for that.
Okay.
I know it's a little confusing, but that's really the model I think we need to get towards. So
I like it, I understand it. Mm-hmm. So in today's society I want to stay on Black women.
Yep.
And they don't feel heard. They don't feel seen. They don't feel as if, anyone cares.
Yeah.
As a physician like yourself who cares, who sees, who is, what do you say to Black women who are at other doctors who may not, like you said, they got to do the 15 minutes in and out.
Right.
Give you the rundown real quick. I send you this medication. Boom. Like, what do you say to Black women who maybe need your service, but don't choose not to?
Right. I would say if you're choosing not to, I understand financially it can be difficult. So I respect that.
For sure.
And I'm going to use a model that I think Black people can kind of understand, right? First thing, get to a Black doctor if you can, because they are going to treat you better. I'm going to use a crazy...
Where can we find our Black doctors at?
There are a couple different resources. So there is a website, blackdoctor.org, I believe it's his, or Find My Black Doctor. So there's a couple different search engines out there. If you know somebody seeing someone, getting a personal referral is helpful. And I'm going to use a weird model here, right? Okay. But if we're thinking about slavery times, right? There might be a nice white massa somewhere, right? If you go to them, they're probably not going to treat you well. But there might be that house Negro, right? They're probably going to look out for you, but they're still working for the man, right? So they're very hand-tied on what they can do. And that's how I felt when I was working for corporate medicine. I was still working for the man. So yeah, I looked out for my sisters, but there's only so much I can do because I'm still working for the man. So I had to make my own private practice to get away from the man and set up a practice that works for me and for my patients, right? That finally puts women first. So I can have 30 or 60 minutes to spend with my patients. So my patients text message me, I respond to them. When they're scared, they call. To be able to have that access, I had to get away from the system. So if you're finding a Black doctor in the system, remember, they're still working for the man. So they're kind of hand-tied. They're going to do their best, but there's only so far that they can take you. So I do think we have to leave the system behind that 90% of the time is harming us. Like, it just doesn't make sense anymore. So if you're choosing not to go to other options now that we know that they're available, I'm not going to say it's on you, but it's kind of on you, right? It's like, just don't say you haven't been told. Don't say you haven't been told.
So now that the information's out there, and of course your practice here locally in Atlanta, how can people find you, learn more about your practice, what you do, specifically, like I said, Black women, Black men as well?
Absolutely.
Because I'm a proponent for all Black everything when it comes to my health.
Yep. And that's the smartest thing to do. Culturally concordant care. We do better, we live longer.
I've noticed, like, some doctors will push me off. Now, I have dealt with some Black doctors who kind of like, but it makes sense that, as you're saying, like, they're tied to a certain thing. So they have to, like, get me in, get me out, and get the next one in. So now, like you said, okay, cool. I don't feel as bad talking about like I used to.
Right.
It just makes more sense, but it's just a physician like yourself who I can spend time with, have a personal relationship with, of course, strictly for medical and stuff like that. It just makes me feel better as, coming to the doctor versus like, well, what's when we go to the doctor if that's people's response.
Right.
Why don't you go to a doctor if they're just going to see me for 10 minutes?
Exactly. And all the money you're paying for insurance, like, we're just getting the short end of the deal. So we have to think differently about the way we pay for that.
So how do you incorporate a holistic practice into medicine? A lot of people nowadays, we're going the holistic route. Like myself, I take vitamins, tinctures, get some vitamin D outside. I go hiking and stuff like that. And I'm working on this whole weight loss situation right now. But like, that's like my only setback on if I want to call it that. It's just the weight. Other than that, I feel fine. I wake up fine, maybe a little tired because I stay up late working and stuff. But
we got to address that, right? Because if we staying up late, we're not sleeping, your cortisol's going to go up, going to be harder to shed those pounds. So we need to have those conversations. So physicians do have to get the training. Like, we've been trained in a very medication heavy model because a lot of times that's all we have time for. It's funny, our tent over here is set up next to Morehouse School of Medicine, which is my medical school. And I sometimes will precept with the medical students, which means like we'll see patients together. And I had a great experience where we were seeing a patient, the students saw them first, they come back to me and they say, Dr. Cooke, we saw Miss Jones in room 1, 60-year-old Black woman, her blood pressure is really high today, we're going to increase her blood pressure medication. I was like, okay. Did anybody talk to her about her diet, her exercise, and what they're being trained in is like, how do you do a visit in 15 minutes? It takes time to talk to somebody about their diet, to talk about exercise, to come up with a plan related to that. But you can prescribe a pill real fast, right? So in this model that values volume over quality, that's what we're getting trained to do. And that's how I was trained too. So as physicians, we have to get trained differently. We have to create space where we have the time to work with patients. So really what my patients are paying for is that time that's going to allow them better health outcomes. So I think that's how we get to that more holistic model. We have to have more time with our doctor. We need to have a long relationship with that doctor. Many of us find we go to the doctor, we like them, we have a good relationship, we come back and they're nowhere to be found, right? Because they're moving all over the place. They're not staying with these healthcare systems. systems. But if you go to a private practice, I'm invested, right? This is my stuff. I'm not just going to walk away that fast. So when you come back, you're going to see me every time.
I love it.
So you need time with your doctor. You need time in the moment and longevity. Like next year when I call, it's the same doctor. The year after that when I call, it's the same doctor. It's not just being bounced around to different hands.
Yeah, because I'm glad you mentioned that, because the thing that sucks most when you're on insurance is that certain doctors only accept certain insurances. So that means you are bouncing between doctor and doctor. That then means your medical history is being bounced between doctors. You have a doctor who probably cared. I had this one doctor I loved, black guy.
Yep.
He was hilarious. His practice, I loved his practice. You know, he didn't just force medicine on me, but I switched insurances, and then I lost. I've tried to find him for like the past couple of years, but like being on a cash-based model is like I can have a real life relationship
no matter what you do or where you go, right? So your insurance dictates your doctor network, right? So there was one point when I was still in insurance-based care where we lost a contract with one of our biggest insurers, and overnight, 40% of my patients could no longer see me because I wasn't in network. Right. So that's that middleman problem. When you have somebody arbitrating your care, they're really the ones in charge and not you. So when you pay cash, just like your gym membership, if you change jobs, you still go to the same gym. Like that has nothing to do with your job. But the fact that our healthcare is so connected to our work, so connected to our insurance. So if you leave jobs, if you get laid off, or even if your job just changes their benefits one year, like that can mess up your whole healthcare situation. So again, take the power away from them. We use our dollars for power, and we're going to use it differently to pay for care.
I love the way you go like that. So where can people find you, of course?
Of course. So you can find me a lot of different places. Our website's a great place to start. I'm SOL Direct Primary Care. SOL is SOL, not SOUL, SOL. SOL is the Spanish word for son. So it's SOL-DPC.org. You can also find me on TikTok. I do a lot of advocacy there. So look for Dr. Cooke. I talk about what a black woman doctor would do. So my black woman doctor's on TikTok. I'm also on Facebook and Instagram. So if you look up Dr. Michelle Cooke, you'll find me there.
All right. Well, you all heard it here. Dr. Michelle Cooke is where you can find her. You can find her at SOL. You said SOL.
Yep. SOL-DPC.org.
DPC.org. Look into the cash-based model. Look into how that you can release everything that you got going on to you inside of you to actually have a better medical outcome.
Absolutely.
All right, y'all. That's Vulnerable Moments, the podcast. I'm Jovan. This is Dr. Michelle. We're out. Peace.
Thank you.